Hello everybody, let's talk about the panoramic imaging, also known as extended field of view. So what is this technology or the panoramic imaging? It's a new technology that's allowing the ultrasound scanning of an extended area of anatomy, not limited to the field of the ultrasound transducer, either linear or convex or whatever. It is extended field of view. So how this technology is performed, the panoramic imaging, okay? Imagine that this is the area, that this is the patient, the light blue area, and then the darker area is the area that we are selecting to have the extended field of view or the panoramic imaging. We should first align the probe along the long axis of this area. So assuming that this area is the area that we are selecting, put the probe along the long axis of this area. And then the next step will be what? The probe should slide over this long axis without rotation, without tilting, without anything, just in the same direction of the probe. So that was the job of the operator. Now what happened in the ultrasound system? All the frames that's been processed, they are saved in succession so that the machine will go in what we call digital matching of these image features. And then the machine will recognize that there are some displacements of these images. So the anatomy here is not the same like the next one is not the same like the next and the next one, so forth. So what happened how? There is some displacement. These displacements are combined together in a successive frames. The machine will put them in a way that they look as if it's one long area of scanning. So they call this digital stitching. So as if these frames are next to each other, so they form one strip of image. And this is what we call the panoramic imaging. So according to this, now what is the display? What you see on the display? On the display, there are two components, like one which is A here. This is the real time. This is the one that you are seeing right now. This is the real time scan. But what about the others? These are the static component or the history of this movement. So as if the probe here is moving or sliding along this direction, the last one is the real-time image, and the previous ones are the static images that are being saved in succession so that they continue as one strip or a long scan. Okay, is there a possibility that the image might be distorted? Yes, it might happen. And there are two main reasons for this. Either there is a large-scale non-aligned tissue movements, like for example, the patient make a deep respiration or whatever. So the alignment of the tissues are not like it was supposed to be. So the machine here will get some distortion of the image. Second thing, if you are moving the probe in an off plane, so this what happened here, this might get the digital stitching non-organized, and this will end up by again image distortion. So what are the clinical applications of panoramic imaging or extended field of view? For example, organs like the thyroid, which are small, I need to get the whole organ in one field, a field of view. So this is one thing. So thyroid, superficial masses, like for example, subcutaneous masses, okay, I might need to see it all over, and this is one of the applications, extended field of view. Abdominal masses like the liver, for example, a liver mass, or I need to see the right lobe of the liver in one image or whatever. So I mean the whole liver in one image. So this one applications. Muscular masses, and we know that muscles are subject of tumors or either benign or malignant or cysts or whatever. So muscular masses, and sometimes you might use it if you have a long segment of vascular pathology like a plaque or a stenosis or a thrombus in a vein, and you want to see it from A to Z in one image, in one strip, and also, of course, we use color here, probably it might be more easier. So in this way, you might have to use the panoramic imaging. So here are some examples. Thyroid here, abdominal masses like this one is extended from this tip to this tip here. Subcutaneous superficial masses like this, muscular mass like this. So all of these are examples of extended field of view. Thank you and see you in another video.